Hello, Andy.
Hi.
Hi, I'm Bruce. I'm a nurse. I'm going to be performing your lung and thoracic assessment.
Nice to meet you.
Nice to meet you. Before we get started, just wanted to let you know what I'll be using. I'll be needing a pen. I'll be using a pen,
Okay.
a stethoscope, and my hands for the assessment.
Okay, great.
All right. Anything that you want to ask me or any concerns of yours?
I don't have any concerns at the moment.
Okay. Just go over your history a little bit and your past. Is there any family history with any lung disease or tuberculosis in your family?
No lung disease or tuberculosis that I know of.
Okay. How about any illnesses in your past or anything like that?
I used to have asthma as a child. I would use an inhaler sometimes, but I haven't had to use one since my early 20s.
Okay. And did the inhaler help you?
It did. Sometimes I would get wheezy with exercise or something, or when I had a cold, sometimes I would feel tightness in my chest and hear some like whistling with breaths.
Okay. Did it ever cause you to be hospitalized or anything?
No.
Okay. Now, while I'm asking you these questions, things that I'm looking for are to see if your breathing is unlabored. Generally, for an adult, respirations are between 12 and 20. Also, I'm looking at your nose to see if there's any nasal flaring or your fingers or lips with cyanosis, which is the bluing of that. And what that could mean is there's some sort of obstruction or some breathing difficulty, which would cause less oxygenation, and that's where it shows up, is in your lips. Okay, nasal flaring would also just show that you are having difficulty breathing and you're using your nose to open up to breathe better. I'm also looking to see if you're using your chest or your belly to breathe, accessory muscles or intercostal muscles, which could cause some sort of concern of mine if you were having difficulty breathing, which you are not.
Okay.
Also, I listen to your speaking, whether you're speaking complete sentences, meaning that if you can't, that you're out of breath or that you're short of breath in any way. Are your respirations shallow, which could mean you're hyperventilating, which could mean anxiety, or if you were hypoventilating, which could mean some sort of pain or maybe some sort of central nervous system depression. Okay, and everything seems normal.
Okay.
All right, I'm going to ask you to, I'm going to examine you now. If you could take off your shirt, and I'll give you this towel so you can cover yourself up.
Okay. Thank you. Do you want me to sit here?
Yeah, could you please sit there?
Sure.
Okay. As I do that, I'm still observing you.
Okay.
And I come to the side, which is your anteroposterior view. I look at that, and then I compare it to the lateral view, which is from side to side. It's a 2-to-1 ratio where the lateral is bigger than the anteroposterior view. The reason I look at that is someone who may have COPD would have like what they call barrel chest, or maybe an older person could have osteoporosis, which could also cause that as well. Okay.
Okay.
I'm also looking at how her breathing is in the expansion. I put my thumbs around the T10 spot and cut my hand around your backside. And what I'm going to ask you to do is take a deep breath for me a few times. Go ahead. And as I do that, my thumbs come out. Go ahead again. And I'm looking for symmetry. And we're okay there. I'm going to inspect your vertebrae. And what I do is I'll palpate your actual vertebrae to make sure to feel the spaces in between, that they're equal. I'm checking if there's any masses or lesions or any kind of tenderness. Does any of that hurt?
No.
Okay. Now, what I want to do is a test called tactile fremitus. Okay, what I'm going to do is I'm going to use the palms of my hands here, and in a systematic way I'm going to work around your lung fields. As I move, I want you to repeat the word 99. Okay? Are you ready? Go ahead.
99, 99, 99, 99, 99, 99, 99.
Okay, what I'm doing is I'm feeling for vibrations,
Okay.
and the vibrations should be equal throughout. Some abnormalities, which would be an increase in vibrations, could mean pneumonia or a lung mass. A decrease in the vibrations would mean that there would be an obstruction in a certain spot, or any kind of like a COPD that someone may have.
Okay.
Okay. Another test would be what I would do is palpate or palpitate. And I do that in a systematic way down through your lung fields. I'm feeling for resonance, and it should be a normal feel. A hyperresonance, which would be an abnormality, which I'd be checking for, could mean some sort of lung mass, and a hyporesonance would mean a obstructed airflow.
Okay.
Okay? All right. Now I'm going to do what they call the lung excursion test.
Okay.
And with a pen, this is where I use the pen. All right, what I'm going to ask you to do is breathe normally, and then you're going to exhale all of your air out,
Okay.
and then hold it there, and I'm going to make a mark.
Or the air out of my lungs.
With the air out of your lungs. Okay, let me know when you're ready. Okay, I'm going to palpitate again. I'm going to go on the left side. Now I would repeat it on the right side, but I'm just going to show the left side here. And then once it feels dull, which is right here, I'm going to mark a line. Just like that. Now we're going to repeat the test.
Okay.
But this time I'm going to want you to inhale as much air into your lungs as possible and then hold your breath.
Okay.
Okay, let me know when you're ready. Okay, same thing. Okay, this is where I felt it to be dull. So I'm going to mark it right here. And I would measure the distance in between here, which would be normal finding would be between 3 and 5 centimeters. If it's a narrower field, it could indicate pneumonia.
Okay.
So next, I'm going to listen to your lungs. Okay, I'm going to have you take deep breaths. I'm going to listen to each field with each breath, and you're going to breathe through your mouth.
Okay.
Okay. I'm going to start systematically again. Start between the vertebrae and work my way down.
Okay.
Okay, deep breath. It's a moderate pitch that I'm hearing. The inspirations and expirations are equal between the vertebrae, and they're called bronchovesicular breaths. Down towards the lobes are vesicular breaths. Nice deep breaths. The inspirations will be longer than the expirations, and it's more of a low pitch. Now, if I was listening and I heard a crackle here, what I would tell you to do is give me a cough. Go ahead. And then I would listen again, and if it cleared it out, it just meant that you just had a little bit of a phlegm or mucus down there.
Okay.
Now, some abnormalities would be, like I said, crackles of someone who was sick who presented themselves, which could mean that they have pneumonia, or if it's someone who has like a heart history, it could be congestive heart failure, where it's a fluid buildup in your lungs and it sounds like Rice Krispies crackling. Okay.
Okay.
All right. Other abnormalities would be bronchi or wheezing, and bronchi or wheezing is whenever there's a narrowing of the airways, and that's generally from bronchitis or someone who has asthma.
Okay.
Okay?
Okay.
All right. Now we're going to move to the front. And basically this assessment in the front is going to be the same as the back.
Can I keep my towel?
Yes, you can.
Thank you.
And I'm just checking for, equal respirations and easy and unlabored, making sure she's not using her intercostals or her abdominal muscles, which I'm just assuming you're not. Now in the front, I can look at her trachea. I want to make sure that it's midline, and it is. I can actually listen to her trachea here, and it's more of a, go ahead, give me a nice deep breath like you did before. And this is more of a high-pitched sound. The inspirations are going to be lower than the expirations.
Okay.
Okay. We can also do the same tests. I can do the, well, first I can palpate, and we're doing here is we're feeling for any masses or abnormalities again. Okay. And I'm working my way down and around. Any pain or anything?
No.
Also feeling for any masses or lesions. Okay, thank you very much.
Thank you.
All right, we can also do the tactile fremitus in the front as well. All right, and you're going to repeat 99 as I move my hands down across your side.
Okay.
Ready?
Mm-hmm.
Okay, go ahead.
99, 99, 99, 99, 99, 99.
Okay, and everything should be equal. It should be a little bit more that I hear up here than more so than below. Okay?
Okay.
And same thing is I can percuss here, and when I'm trying to here's any kind of mass, if it's dull or anything. Now it would be more dull in your diaphragm area, which is normal because it's over like your liver and whatnot.
Okay.
Okay, and I can also listen here, front.
Okay. Breathe through my mouth again.
Breathing through your mouth again as I go through each spot. And up here I should hear bronchovesicular sounds, which is moderate again. And then down in the lobes, it'll be more vesicular, which is low pitched. And inspirations will be higher than expirations. And we would be checking for crackles and rhonchi likewise. Okay. Thank you very much, Andy.
Thank you,
You're
Bruce.
healthy.
Thank you.